All right, let's go over the top 5 scams out there for Social Security and Medicare. So this is also a live Q&A. So if you have been the subject, the target of a particular scam, whether you fell for it or not, let us know. We need to get as much information out there. These scams, particularly with AI, they are improving every year and they're being more lethal and they're ripping a lot of people off. So let's make sure you and your family and your loved ones are protected. As usual, every time I make a top 5 list, I always add extra stuff in there. So I always can give you a bonus. So we'll talk about 5 plus, and then we'll get into your particular questions on all things Social Security, retirement, disability benefits, survivor benefits, Medicare, Medicaid, all the rest of it. Okay, so here's one that I was a target of when I was working at the Social Security Administration, sitting there in my office. And I got a call supposedly from the Social Security Administration on my private phone saying my Social Security number is going to be suspended and I'm in trouble. I'm going to be arrested and whatever. And I'm like, huh, that's interesting. What is your name and what DO do you work for? What district office do you work in? Oh, my name is John. I work in Dallas. So I pulled up the Social Security employee database there and I'm like, John in Dallas. What's your last name, John? Oh, it's Martin. Oh, really? Well, there's no Dallas, there's nobody by that name in the Dallas field office. How do you know that? And then I tell them and they hang up on me. So it happens to everybody. So be very, very careful. If somebody calls you from Social Security, the only time people will call you from Social Security is if you have a pending claim. If you recently filed for benefits or something, and they need some type of documentation or they have a question or they need something, then they'll contact you. But if not, then particularly now, Social Security is terrible in terms of staffing. They just don't have the employees. So, I mean, I guess that's a good thing for scamming. In terms of if you get a call from Social Security, it's not that because they don't have people to call you to help you out, unfortunately, even to help you out when you need help. So just pretty much hang up on them unless you have a pending claim. And if you have a pending claim, but you're still wondering whether that call is a scam, what you can do is say, okay, what exactly are you calling for? Oh, because you recently filed for benefits. And even then they might know that because as we know, Doge has uploaded everybody's records into some unprotected cloud. So we're not sure what kind of information is out there right now. So probably if you're suspicious, then when you file, they might have given you a phone number that says, okay, this is the person, handling your claim. Usually they don't because they're so overwhelmed. But if they do, just call that person and said, okay, let me call you back. Or you can call that local office, or you can call the 800 number, the Social Security 800 number and say, hey, somebody just called me and, I was wondering, I do have a pending claim, but I'm a little bit suspicious. So are they really looking for something? And they can look at the record, your pending claim. This, oh yeah. They had a question about your birth certificate or your earnings last year or something like that. So stay safe on that one. Okay, so and their Social Security doesn't suspend your record or your Social Security number or anything like that unless they'll send you an actual letter. All right, so let's move into the letters now, and particularly the emails. These were usually pretty easy to spot before because some of those emails that came in, it always, anytime you took any type of training about this phishing, where they're phishing for information, they send you an email, they want you to click on this, they're trying to find information about you. A lot of those emails, the English wasn't that great. So that was a telltale sign that, okay, this is from overseas or something. But now with AI, the English is very, very good. With AI, they come up with these algorithms where they can just create an enormous amount and send out millions, billions of emails. And if they only get, 0.0001%, then it's a success. They're making tons of money because AI did it in 5 minutes. So these are going to really, really increase. So we have to be on our toes. So if you receive something suspicious, obviously don't open it. Definitely don't open the attachment. If if you've signed up for a My Social Security account and, the Commissioner of Social Security is sending emails saying, hey, look how awesome we are. And, but I've talked about that. Don't click on any links. If something is going on, like the COLA is going to be announced here in the next few weeks, and people will probably get emails that say, and hey, we've increased the COLA, and therefore next year your benefit amount is going to be X, Y, and Z. Okay, that's fine. But don't click on the link that supposedly is from the Social Security Administration, even if it looks from the Social Security Administration, because it could be fake. So, I've got an email from the Social Security and it talks about COLA and it says, click on this link to find out how much your benefit is going to increase. Delete that. It might be official, but I would delete it anyway, just in case. And then just go type in SSA.gov. Type in SSA.gov and go through, go into your account to see the email about how much your benefits are going to increase. That's probably the safest way to do it. But don't click on any links that, and one of the other things out there is, hey, you're eligible for these extra programs and, disability. Can you get extra money on your retirement and stuff? No. Stay away and watch out for those ones. Okay. Another one for those people on disability. This is kind of a new one, but I've heard some people on disability talk about this. Disability work scams. When you're on disability benefits, SSDI, SSI, whichever one, you are allowed to work. There's obviously different limitations for each one of those programs. If you go onto my website, mygovexpert.com, then I've got all of the information there. I've got a PDF that you can download 100% free, and it tells you about trial work period, extended period of eligibility. I've got a calculator there. It's all free, so definitely check it out. Bunch of information, retirement benefits, living overseas, veterans, Medicaid, and all the rest of it. So if you're on disability benefits, go there or go to ssa.gov or watch my videos I do on working and collecting Social Security benefits. Coaches, yeah, I would be very hesitant on those. There is what's called a Ticket to Work program. So this is an official program, an organization that Social Security contracts with to help people who want to go back to work while receiving disability. And that's a good place to go to. Again, Ticket to Work. But anybody that's going to charge you to coach you to go back to work or anything like that, be very, 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 very careful. Okay. You are allowed to work, very limited, while you're receiving disability benefits. Okay. All right. Another thing is these benefit fixers, these so-called experts. There are several companies out there that give people, usually they're like Medicare insurance agents. They like doing these. They like going out the country and giving Social Security seminars, which please stop, because they take a 2-day online seminar, and then they go out there and give incorrect answers, and people make lifelong decisions based on someone that took a 2-day correspondence course on Social Security. When you're hired by Social Security, which doesn't look like anybody can be hired in the near future here, but anyway, anybody that's hired at Social Security, they go through 3 months of training, and then after that, about a year or so, every single time they push a button in the computer system to adjudicate a claim, their claim is reviewed by a technical expert. So yeah, that you just can't get that in 2 days. But these people take these classes. They said they're a Social Security expert, Social Security advisor after 2 days of online training, and they get this cute little certificate that says they're advisors and experts. And so you go in there and ask them a question. And unfortunately, some of these people say, okay, yeah, I know retirement age is 62, and I know full retirement age for most people now is 67. And yeah, that's what I learned in 2 days. But some people, they get embarrassed when they're up there in front of a seminar and they just start making stuff up because they don't want to look like they don't know what they're talking about. So if you don't know what you're talking about, just don't say anything, right? The golden rule. So that's not the golden rule. It's the nice rule, right? If you don't have anything negative, okay, anyway, I'm messing up my rules. Okay, so be careful of those. And then in the same type of thing as I talked about before, There's a lot of things. COLA comes out, and can you get more money? Click this website. A lot of these social media thing and these so-called news articles that you see online, it's like, millions of people are getting, $5,000 extra a month. Click here to see if you're eligible. Stay away. Stay away. Okay. And quite often they use something that's correct, but then they use it for ulterior purposes, like the Social Security Fairness Act that was passed during the Biden administration that is currently giving out benefits right now to people that worked in, federal, state, city, local governments that are getting, some $5,000, $6,000, $7,000. Those are accurate programs that about 95% of those benefits are already paid. So that's correct, but it's not for the other 97%. I disagree with that whole Social Security Fairness Act, but that's a whole different issue we won't discuss here today. Another one is obviously ID theft. I guess they say the horse has left the barn there, considering, every time we, open the newspaper, as they used to say in the old days, there's some other hospital or credit card company or financial institution that lost our Social Security numbers, or put them out on the dark web, or whatever the case may be. It hasn't been Social Security up until now. It's always been some other private company, the credit card company or whatever, that has lost that information. It's never been Social Security that's lost massive amounts of information until now. Until we find out that a Doge person uploaded it, and we don't know. It'll probably take a few months to figure out whether that was actually leaked to the dark web, but it was in an unsecured. It looks like it was a place that it shouldn't been. I know, running the third business Social Security office in the country, if any of my 100 employees did that, they would have been fired. End of story. Super simple. If they put in a flash drive into the Social Security system, or they uploaded a bunch of stuff, bye. Sorry. As we used to say in the Marine Corps, big chicken dinner, bad conduct discharge. So be very, very careful. If you've got one of those old Medicare cards with your Social Security number, you need to get that fixed. You need to get that changed. The new Medicare numbers have a specific Medicare number on them. They don't have your Social Security number anyway. Social Security got smart, or Medicare got smart a few years ago, because we used to tell people, hey, don't carry your Social Security number, your card, around in your wallet or purse, because you've also got your ID with your address and your date of birth and stuff. And so don't carry your Social Security card around. But then they gave people Medicare cards with a Social Security number on it. So that was always kind of stupid. They have since fixed that. So your Medicare card should have that new card number, but if it has your Social Security number, make sure you contact Medicare and get an updated one. Okay, and there's also a scam out there. This is number 6, even though I said I'm only going to do 5, but number 6 is there's companies out there trying to scam people by saying, oh, we're going to a new Medicare card. And they went to a new Medicare card several years ago, but the scam is, oh, we're going to a metal card, a brand new Medicare card, so we need your information so we can send you this new updated card with a chip and yada, 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 all this kind of cool stuff on it. No, Medicare and Social Security are still using those old flimsy paper things, so don't fall for that one. And one of the other things is, if you have a Medicare supplement plan, like a plan F or a plan N or a plan G, and then you also have a Part D plan, because you have to have a standalone Part D plan if you have a Medicare supplement plan. What I'm seeing is, because these companies, these Medicare insurance companies, they make more money when you enroll in a Medicare Advantage plan. So they would really like to switch you to a Medicare Advantage plan. And a lot of the companies that have Medicare supplement plans also have Medicare Advantage, and they would like to switch you to that one. So, but they can't contact you like that. But if you have a Part D, that means you are their customer, and therefore they are allowed to contact you. So they contact you and say, hey, we just want to let you know there's a new plan in your area, and we've got dental, vision, and hearing, and free ice cream and unicorns, and it's so awesome. Do you want to switch? And then, oh yeah, that sounds great. So you're the same company I've got this with, and I can consolidate this, that, and the other. And that's fine if that's what you want. If you want to switch to a Medicare Advantage because your Medicare supplement is getting too expensive or whatever the case may be, if you're making that as a logical, conscious decision based on information, then more power to you. But if not, then definitely watch out. So, and we are coming up on the season where everybody and their mother, as we used to say, is going to be calling you this Medicare. October 15th is when it begins. So it's going to start being very, very crazy starting October. And these companies are not supposed to be contacting you unless you have contacted them first. So if some Medicare insurance agent or whoever throughout the country contacts you, then they're not supposed to, unless you told that person or that person's company to contact you. If they're calling you out of the blue, which they're still doing what they're not supposed to do, cold calling you, they could lose their license and never be able to, market Medicare again, which is, some of these people are going crazy out there. Jeff says you're not very helpful. Is that me? Is it Jeff? Is that my wife pretending to be Jeff there? So, all right, let's get in some actual questions here. Nelson, if you haven't done already, please don't forget to hit the like button. Yes, thank you very much. Ellie asked, how do I ask a question? There you go. You just did. Pink Owl says, yeah, Ellie, you just did. Okay, here's your question. Thank you, Elle. Ed, I am paying $55 a month for Part D with extra help. Wow. Okay. I just got a letter in the mail. It's doubling to $110. It's company. What should I do? You should definitely 100% check. So if you have a standalone Part D plan, that means you have a Medicare supplement plan, like an F or a G or an N. So you just need to find another one. And there's a lot of these companies this year that are getting out of the market. I always avoid using company names, but in this particular case, I think everybody has already heard about United Healthcare getting out. Let me pull up the list here. So United Healthcare is eliminating Medicare Advantage plans for about 600,000 members. So if particularly PPO plans. So this is 2026. They're trying to make more money. They're either, expanding, trying to get new customers, or they're in there, we need to make more money off each customer. Next year, it's we need to make more money off each customer. And PPOs, they don't make as much as HMOs. So if you have a PPO United Healthcare plan or an Aetna is also closing 90 Medicare Advantage plans across 34 states. Okay, I'm going to say allegedly. I've seen these the announcements directly from the companies, but these companies like to anyway. So they might say, "Oh, you're giving out wrong information. There's only 89 Medicare Advantage. We changed our mind on this last one, and Ed's giving out wrong information." So allegedly, but 34 states, mostly PPOs. Again, PPOs they don't make as much money as regular. Elevance Health is closing some. That's Anthem, Blue Cross Blue Shield, cutting some. About 150,000 members so far are going to be affected so far. UCare out of Massachusetts, Samaritan Care in some counties. UCare is in Minnesota and Wisconsin, western Wisconsin. Sounder Care is in Georgia. They're terminating effective October 1st. So there's some craziness happening in the entire Medicare Advantage, and Elle can attest to that. That her Part D plan has doubled. So starting October 1st is when you can start seeing what else you have out there. So if you have a Medicare supplement plan, you don't need to do anything with the Medicare supplement plan. A G is a G is a G. It's going to be the same G this year as it is next year. The prices might go up. So if you want to check to see if you can find a cheaper G, or you can switch to an N, or whatever the case may be, you can do that any time of the year, 365 days of the year. You might have to go through health underwriting, depending on your particular state. So on yours, I would definitely check out. So the extra help should be helping you. It helps you to a certain extent. That changes every year. So that's the extra help with Medicare prescription drug plan. And that is something you apply for from Social Security. It's like one of the easiest Social Security applications. So if you have someone that you or someone that are having difficulty paying for their Part D, the deductibles, the co-insurance, or the premium, or whatever the case may be, please, please, please make sure they reach out to Social Security and file for that extra help with Medicare prescription drugs, also called the LIS, low income subsidy. So, got my first call today for my rib dib. Went very well. It was someone that knew me from our local office. I got lucky. All right, good deal. All right. So it sounds like they're taking care of you. So people say, what is a cold man XRP? What is he talking about? He or she? Oh, man, I guess. Anyway, rib dib. It's if, let's say you're 62, 63, 64 years old and you want to go ahead and file for your retirement benefits, but you also believe that you're unable to work because of a disability. So disability, you want to go ahead and file for disability, but you can't wait for 9 months to get a decision. You need money now. So that's why people file for RIB, retirement insurance benefits, at the same time they file for disability insurance benefits. So they can get the disability process started, but they can still, buy food, I guess, in the meantime, because they're getting Social Security checks coming in. So, Joseph, I called my ANOC case manager today. She told me to come in her office next month to help me. Perfect. Awesome. Good deal. Yes, that's if you get the annual notice of change, which are going out. So looks like a bunch of people already got them. You're supposed to get it by the end of the month. It'll tell you all the changes for your Medicare Advantage, your Part D plan for next year. And if you need help, you can reach out to our partners at Chapter who sponsor this live Q&A. They can help you. They're 100% free. Nobody should charge you for any of this, included. Joseph knows that. He's got someone local he knows and trusts, and so he's going to take that in there to see what else he can get for next year. So that is a beautiful thing. Most important thing is to get help. Because it's, since it's free, you already paid for the help, right? So, as disability from age 18, but worked part-time for 2 years before, I'm concerned if I should match parents' quarters to get higher Social Security, but I will qualify for Medicaid. I have a dual plan. Yeah, you can't really match parents' quarters. You can't add those up or anything. So, sounds like you filed for disability. And you're either getting it on your own record or you're getting it based on your parents' record, which is called a disabled adult child benefit. So you get either one. So it's, you can't get two full checks. If you get, two, then one offsets the other. But yeah, you're going to qualify for Medicaid, and you have a dual plan. So that means Russ has Medicare and Medicaid. And when you have Medicare and Medicaid, you are eligible for what's called a Medicare Advantage dual eligible plan. And those are the ones that have the extra bells and whistles, usually a little bit more than other plans in your particular area. But watch out. In 2026, the law has changed. And remember those awesome grocery cards, the over-the-counter cards and stuff? Those are kind of going out, not completely, but a lot of those are going to be cut back. So if you've been getting one of these Medicare Advantage plans or something, and it's got like $100, $200, $300 a month, then there's a very, very, very good chance it's going to change considerably, because the regulation that allowed those is expired December 31st. And so a lot of those are going to go away or be reduced dramatically. So you definitely need to check your plan, or you may have to change it unless it's the best plan. So absolutely. Most important thing is to check. Whenever you get an email or phone call from Social Security, credit card, bank, insurance, etc., do not reply. Go online and check your account directly and or call the institution directly, no matter what. Yes, good point. And I just said yes. And with the new technology and AI, it's all getting scary. If they call you up and they say something like, "Can you hear me?" and you say yes, they recorded that yes in your voice, and now they can use that in some crazy ways. So Yeah, just be very, very careful out there. These scammers are getting very, very smart. So I'm 65 and collecting from a former spouse. If I remarried, do I have to pay anything back to Social Security? No. But if you remarry, then your benefits from that former spouse, if that spouse is still out there alive and kicking, then your benefits will stop. If it's a surviving spouse benefit because that person is deceased, then those benefits will continue. And you won't have to pay back unless they overpaid you because you didn't notify Social Security that you got married 6 months ago. And then Social Security should have stopped your benefits perhaps 6 months ago, and then you would have to pay that back. But if you notify them in time, no problem whatsoever. What happens if the government shut down? Do we lose our checks? No. Historically, I think this is going to be a different shutdown than normal. But historically, Social Security is considered essential services. And I'll do a video here, and because I know there's going to be a bunch of people doing videos about your check is going to stop because of it's shut down. And so I usually do a video anytime this happens just to say, the first 5 seconds of video and says, no, you're still going to get your checks. Don't worry about it. There are certain things within Social Security that are not essential services. So if you need a Social Security card or replacement Social Security card, you can't get it during the shutdown. If you need a benefit verification of work history for some type of mortgage, or background check or something like that, they can't do that. That's not considered essential. But pretty much everything else is essential services. People need their checks and they need to pay their rent and all the rest of it. So a shutdown doesn't usually hurt. Social Security, nor will it hurt you. I will be eligible for retirement mid-April. When should I apply for Social Security? So about 3 months before. Yeah, so you can do it online. The most important thing right now is to go into SSA.gov, set up a My Social Security account, and check your earnings record and make sure everything is correct. If it's not, then you need to start thinking of a way to get those earnings corrected, because that's how they're going to determine how much you make for the rest of your life is based on how much you actually paid into Social Security. So how much money can you make at 62 with Social Security? $23,400 is the earnings limit for this year. So anything over $23,400, Social Security holds back $1 for every $2 you go over. Jassam, my Social Security starts next month around October 22nd. The Social Security letter says they will deduct the monthly amount for September, but I also received a letter to remit Medicare payment. Yeah, I would pay it. Because if Medicare doesn't receive your money, then it's an issue. So on yours, you start in October, so you're 65. I just, if you don't have the money, maybe pay a month or it depends on the timing of everything. When they adjudicate your claim, when you turn 65, are you losing health care, from another place? Are you in your special enrollment period? I always try to play these very, very safe. Because if you overpay, if you pay twice for 1 month, send them money, but they also take out of your Social Security check, then they'll refund the money. So usually it takes about a month. The system will recognize there's an overpayment on the record and it release that funds to you. So, but what you don't want is for a month not to be paid, and then there's issues. And if you have a Medicare supplement plan or Medicare Advantage, and they say, yeah, we're going to deny you this because you didn't have Part A and Part B, and so it just becomes a nightmare. So I would just be, if you got the money, the safest way to do it is just pay it, and then they will refund your money. So I always say play it safe on that. Sheila, I filed for surviving spouse benefits in October 2023. However, benefits began January. Should I have been eligible for November? If so, can I request retro benefits for November, December? Thank you so much. You're welcome, Sheila. Didn't do anything yet, but I'm going to take it as I get it. All right. So surviving benefits in October. So if you're under your full retirement age, is the reason you didn't get October, November, December because you were working and making over, whatever it was in 2023? It's 2023, so it's going to be hard to go back, but you can always go back. request anything. Whether they approve your appeal to give you those extra months, that's an entirely different thing. But the reason they didn't give you is because maybe you're working over and you were under your full retirement age and you made over the 2019 or 20,000 or whatever it was that year. But remember, there's the annual and then there's the monthly. So there is the monthly thing. Let me pull up my website here, and under retirement, working and benefits, you'll see that there's what's called a earnings limit, an annual and a monthly. So if like this year, if you're going over here, it's September and you want to start your benefits in October, but up until this month, September, you made $1 billion. Social Security doesn't care. They say, okay, we can't start your benefits in September because you were still making part of $1 billion. But in October, are you still going to continue making that much money? And you say, no, I'm going to stop my $1 billion job today. So starting October, I'm going to earn under $1,950. And then October, November, December, I'm going to stay under the monthly earnings limit. And the monthly earnings limit is $1,950. So they said, okay, all right, we can start your benefits in October because you're going to be under the monthly limit. We don't care about the $1 billion you made before you started your benefits. We only care about how much you're making when you start your benefits. So, and then next year, there is no monthly, it's the annual. So you have to stay under the annual earnings limit for the following year. You can't switch to a monthly 2 years in a row. So unless you withdraw your claim, and there's always exceptions, but all right. So maybe that's why they didn't start your benefits at that time, because you just earned too much or they messed up. So you can definitely request if you believe you are entitled. Remember, anytime you collect benefits early from Social Security, it's reduced every month you take it early. So if you take it 3 months early, it's going to be reduced by 3 months, which usually it's not that much, but it's going to be that reduced for the rest of your life. So. Susan, I just signed up for Medicare yesterday. I have been following and listening to your advice for a while now. My spouse didn't believe me, but our agent backed me up. Okay, all right, good deal. I haven't received my back pay for March. They wrote a check on July 9th. I never received. They resubmitted, but now they say 30 to 60 days help. Okay, yeah. That's because those type of things are probably under certain circumstances, it can't be adjudicated. The check can't be cut in the local office. It has to go to a regional processing center. And unfortunately, Doge and Elon Musk closed down most of those. So there just might not be anybody there there's nobody there to do it, unfortunately. So maybe you should contact your politician and say, hey, how come Social Security is, not helping people out? Weren't they charged with making sure people get their benefits? And this hasn't started, this has been going on for a long, long time. Politicians have refused to fund Social Security, to support Social Security for a long time. The gray lines there, those are the baby boomer population, ever increasing, but the Social Security employees to help you get your benefits, make sure you're getting all your benefits, they have continuously decreased over the years. And now it's even before Doge and Elon Musk came in, Social Security was at a 50-year low in terms of staffing. And now it's probably as low as it's been since 1935. And that means it's hard for people to get what they're eligible for. So my husband is thinking of retiring in April 2026. When should he request? Yeah. When should he request his first Social Security payment? If he's going to start April, you can start in April. Then the April check, obviously, Social Security always pays 1 month in arrears, so the April check comes in May, but about 3 months before. So you can file online, call, schedule an appointment, all the rest of it. So, and again, make sure he checks his earnings record. Ed, caller should apply for QMB. Medicare approves it. Call the free Medicare Help Plus Medicare office. Yeah, so the QMB, Qualified Medicare Beneficiary, that is part of the Medicare Savings Program. So the Medicare Savings Program is one that a lot of people don't know about, which a lot of people could benefit from, but it's also one that's going to be the target of the one big beautiful bill because, yeah. Anyway, so the QMB, it's part of the Medicare Savings Program. So if you or someone you know are receiving Medicare Part B, that $185 a month, and they're having a hard time paying for that, tell them to apply for Medicaid from the state, whatever Medi-Cal, whatever it's called in your particular state. They go by different names. Tell them to apply for Medicaid from the state, and if they're approved at the higher levels, then they will be eligible for that Medicare Savings Program. And the higher levels are the QMB, the SLMB, SLMB, QI, those higher levels. And then the state pays for the $185. And you're eligible for those Medicare Advantage dual eligible plans, which I usually recommend Medicare supplements. But if you have Medicaid, you can't get a Medicare supplement. It's illegal to sell you a Medicare supplement plan. So you get a Medicare Advantage dual eligible plan. There might be some extra benefits in there as well. So, Bonnie says, chapter is great. Oh, thank you for the information. Yes, I'm keeping an eye on anybody that we recommend. I've been telling a lot of people about chapter. Perfect. Yeah, and make sure they use that phone number there, and that way, they help us out. The website and our new website that we're coming up with that is probably going to go live beta test to about a few dozen people probably next week. So I've got those people's names, and so I appreciate it. You're going to be the testers, the guinea pigs. There's no one better out on YouTube than Dr. Ed. Oh, thank you. Giving we the people the right and correct information about all this complicated mess. Yes. And I'm the first one that said, I shouldn't be having to do this. You should be able to call Social Security and they pick up the phone and they answer your questions. You should be able to call, Medicare. Sorry, chapter. I don't think original Medicare should cover everything. You paid for decades. Medicare Part A, Part B should cover everything. You shouldn't have to get a Medicare Advantage, Medicare supplement plan. Sorry, chapter. I've told them directly. It says, I think none of y'all should exist. I think original Medicare should cover everything. But yeah, that's not a reality. So until that becomes a reality, yeah. Why Medicaid pay for in-home, yet Medicare not? Mystery to me. Yeah, there are certain things, Medicare doesn't, cover, nursing homes and stuff like that. Certain in-home Medicare Advantage plans due to a it depends on the plan, but Medicaid does. So yes, it's the whole system is completely messed up. So there's that. If you're on a green card, are you allowed to go out of the U.S. without losing your benefits? Yep, absolutely. If you're going to be moving, then that's a whole different situation. It really depends on what country you're going to be moving to. And the way to check that, go to my website, mygovexpert.com, click on the living overseas, and this takes you to what's called the payments abroad. It tells you all about the stuff about living overseas and, Medicare and getting your benefits and banks and reporting requirements and all that kind of good stuff. But it also gives you the link to the Social Security website, payments abroad screening tool. So I'm going to practice what I preach. If you don't want to click that link, more power to you. Just use that name and Google payments abroad screening tool, and it'll take you to, let me make sure the link is working. It'll take you to that tool, and you just answer a few questions there, and it'll tell you whether you can get your benefits if you move overseas. Oh, and speaking of, I've got a video question about that. So hunting and stuff with J&J. Update, the lawyer took my wife's case for SSDI, says there's a great chance of winning, but it will take about 15 to 19 months to be all said and done. That seems like a very long time. Yeah, so that means that you were denied twice. you were denied at the initial stage, or she was denied at the initial stage, and she was also denied at the reconsideration stage, and now you're at the ALJ, the administrative law judge stage. And yes, it takes way, 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 way too long. And secret on lawyers, allegedly, the lawyers always tell you, oh yeah, if you use a lawyer, you know, there's a 40% better chance of you being approved. Well, yeah, when you pick your customers, of course. It's like, you know, it's like voting nowadays. You know, we don't pick our politicians. Our politicians pick us by gerrymandering. But anyway, that's a whole different. But lawyers, you call a lawyer and you say, yeah, I want you to help me with my disability claim. They're going to start asking you a few questions. What's your disability? Oh, I've got, you know, high cholesterol. And they're going to say, yeah, sorry, bye. And someone else, oh, I've got, you know, I broke my big toe. Yeah, okay, sorry, bye. And if you call them up and say, oh yeah, I've got this terrible condition, they say, oh, okay, that one sounds like it's going to be approved. I'll take that. So yeah, of course, then, because they're able to pick and choose, so they can come up with those numbers that said, yeah, if you use a lawyer, then, so yeah, allegedly, I don't want to get in trouble with lawyers out there. How much will the Social Security Fairness Act accelerate the depletion of Social Security trust funds? Yeah, good question. It's not all said and done yet, but I'm thinking probably about 6 months to a year. It's going to deplete it faster. Yeah. So I guess it's time for me to show the one I show every single day. You have 88 more checks that are at 100% of what you're going to get. And then after 88 checks, your benefit is going to be cut by 23%. And this didn't, so this is January 2020, 88 more checks means January of 2033. This is based on the Social Security Trustees report. Some other ones say a few months earlier, some say a few months later, but they haven't figured in the Social Security Fairness Act. So I'm thinking it's not 88, it's probably 80, 82 now, at least, before we get that 23% cut. Everybody. Why? Because of that. So politicians have failed us for 40 years because we've just decided to, yeah, focus on cultural wars and attack each other rather than getting things done. So, Michelle, Dr. Ed, my nephew's 25 on the autism spectrum and gets SSI. He wants to get a part-time job, earning approximately $900 a month. How will this affect his SSI amount? Significantly. So he's receiving SSI, Supplemental Security Income, which is a needs-based program. So it's it's going to be cut, you know, basically 1 for 1. There's a few exclusions in there. But he'll still get SSI, and you know, so he'll still get the amount. If he makes over that, then what they do is they cut off his SSI for that particular month, but he still continues to get it. He just doesn't get the money. He's still qualified for SSI, but he doesn't get it because he made over the 967 and 87 with, you know, exclusions and stuff. So I say that because even if you don't, like, let's say he makes, you know, $1,200 one month. And so they cut off his SSI. He doesn't get a check, but he's still technically eligible for SSI because of his disability. So the Medicaid. So if he's getting Medicaid, they'll still continue to get Medicaid because of that. So yes, he is allowed. Make sure he contacts you or his representative payee or whoever contacts Social Security and say, hey, here's the deal. We're going to do this. And, you know, if he makes, you know, 800, they'll run the calculations. There's also some, you know, sheltered work environments where, you know, even though he is getting $900, sometime they can exclude part of it because, you know, his boss is, yeah, I'm giving him what everybody else does, even though, you know, the person does half as much work and stuff. So sometimes they can play around with those numbers. So make sure you do it, you know, contact his claim specialist at Social Security and then go through the deal. And yeah, you know, going out there and getting out there and socializing and stuff, sometimes it makes a world of difference. So absolutely. Bella, a friend in Canada, couldn't obtain an appointment with doctor unless emergency. No joke. They went to another province. Yeah. So there you go, Beverly. Good point on that last point. Yeah. Canada does a lot of their universal healthcare type system based on the province. So some provinces are doing better than other provinces and stuff, but I think every province is doing better than every state in America. And it's getting even worse. So, I mean, we've got one of the best healthcare systems in the world if you got the money. If you ain't got the money, then yeah. When Social Security calls, it shows up as a public service on your caller ID. Found this out recently when I had a scheduled phone appointment. Yes, but companies have learned how to spoof that. So, and in my office, it always showed up as the U.S. government, except for a few months where we would call people and for some reason nobody could ever figure it out that at the phone company it would show as Walmart. So we would call people and we couldn't get a hold of them with their appointments because they didn't want to pick it up on Walmart because they were waiting for their call from Social Security. So that was a nightmare. Somehow they fixed it and they never told us how it got messed up. So, but even then, these companies can spoof that. So it's very, very easy to spoof it. So, and pretend to be whatever. Let me see here. My Part G only went up $13. Wow. I don't want to shout yay or they will chase. Yes. All right. We won't tell anybody, Lori. Yeah, $13. That's not bad at all. So, and for some reason, yeah, I wish they would. A lot of these Medicare supplement plans don't tell you how much they're going to increase your monthly premium until after the annual enrollment period, until after, January, February, March or something. That's when they tell you. I wish they would say it like right now. And that way people just say, oh my gosh, my Medicare supplement plan is going to go up $70. And so I can't afford that. So maybe I should go ahead and switch to a Medicare Advantage plan. But for some reason they don't do that. So, have you applied online through a Social Security account? If not, you need to do that and provide bank info for direct deposit. Yep. Make sure you get that direct deposit. Remember, checks are going to be stopping at the end of this month. And yes, social media is using that fact, that is a fact, as another way to get clicks by saying, oh, your payment is going to stop. No, only those very, very small number of people that are receiving a paper check. So you need to switch to direct deposit, set up a Direct Express, which is like a kind of a system that Social Security contracts with as a kind of a debit card type thing. Or there's an exception that you can request from the Department of Treasury and say, hey, I don't want a bank. I don't want a Direct Express. I want a paper check. And they're supposed to allow you to keep that. I'm not sure how that's going. So if anybody's done that exception, requested that exception, please let us know. All right, let me get some video questions here. This first gentleman has 2 questions, and they're pretty good questions, so we'll check out both.
Hopefully you could clarify it for me. I'm currently 61, took a voluntarily early retirement from my current position, but I still plan on working at least part-time to get to my gap, for medical until I turn 65. My son's been disabled since a child, so I'm filing for his DAC benefit. And also my wife, she's older than me. She's already collecting Social Security at 62, which is a small amount, maybe $500 a month. So when I plan on collecting at age 62, I plan on using my family benefit total, which is like around $5,900. So, my son will collect his 50% portion, and my wife will collect her 33% portion. She's collecting early. Um, when I go file for my Social Security at 62, can I file at the same time for both of them, or do I need to wait, start collecting, actually get a check from Social Security, and then go ahead and make another appointment and file for their spousal and their DAC benefits? Um, in regards to the DAC benefits, also, I'm not sure if my son does get his Medicare, how does that work with the Pickle Amendment? He would still get his Medicare because of the Pickle Amendment, along with his Medicare would be primary and Medicaid would be secondary due to the Pickle Agreement, since his disability was from childhood. I was wondering if you could confirm that.
Okay, all right. So to file, so it sounds like you did the right thing. If he has Medicare, because what I was going to say is, don't wait to file for disabled adult child benefits on your record if your wife is receiving benefits, because the child should receive disabled adult benefits on in his mother's record because receiving. So in that case, you're good. It sounds like he is receiving it because he is receiving Medicare. So that's good. And then when you file for benefits on your own record, you'll do it all at the same time. And it'll be, so you'll file for retirement benefits on your record. The spouse can file at the same time. So if you go down, schedule an appointment, I wouldn't do this over the computer anyway, because you got too much stuff going on. So I would schedule an in-office appointment, and then you and your wife go down there and you file for your benefits. She files for spouse benefits on your record, and then you file for the disabled adult child benefits on your record. And what they're doing is, since it sounds like he's already receiving benefits, he's already been approved for disability, then they still have to go through the rigmarole to switch. It's not like an easy where they take his disability and convert it from hers to yours. I wish it was that easy, but they have to go through a little bit of rigmarole there to switch it over. But that's their issue. So they'll switch benefits over to yours, so he'll get a higher benefit amount. His Medicare will still continue. In terms of Medicaid, it's even with existing issues, they're cutting close to $1 trillion out of the Medicaid system. So I'm not sure what state you're in. But usually he should be good. But we need to keep an eye on that part, just to make sure that Medicaid continues. So what he's talking about is, even though he's making more money on the disabled adult child, is going to be making more money because receiving off the father's record in some states, sounds like he's already done his research in his state, that he'll still continue to get Medicaid, even though he's above the income thresholds with those new benefits. But that's an ongoing nightmare, unfortunately, with all the cuts. So, and this gentleman has a follow-up question here.
Hi, Dr. Weir. Sorry, this is my follow-up question to previously. I was talking too much. I'm also considering filing for SSDI for myself. I think I may have enough ailments between my back, upper back, neck, some other chronic conditions. Um, how would you handle that? I still planned on filing at 62, possibly working. Would you file at the same time, or should or should I just file for disability right now and then just move along once I'm eligible to file for?
Okay, so that's a lot of decisions you have to make. So, but you said you're going to still work. You can work and collect disability benefits as long as you stay under $1,620 this year. So that's called the substantial gainful activity for disability. But if you don't file for retirement benefits, that means your disabled adult child won't receive benefits starting that month. Your spouse won't receive benefits starting that month. Remember to check out the auxiliary child and care benefits. I'm not sure how much she's receiving, but she could receive auxiliary child and care benefits, rather than spouse benefits. It depends on her age. But if you don't file for retirement benefits, then nobody can start that other benefits on your record because you didn't start benefits. So, but if you file for disability and you're approved starting, after being, going through the rigmarole for 6, 7, 8, 9, 10, 12 months or whatever, they'll pay back pay. But another option is to go ahead and file for retirement benefits so the two can start their benefits, and then you can start the disability process. And that way, 12 months down the line, if they approve your disability benefits, they'll give you that retroactive extra, because disability payments are not reduced for early filing. Retirement benefits are. So you got a lot of decisions there.
Can you tell me, has Social Security phased out proof of life form? Thank you.
No, they haven't phased it out. They just added another option. And people are complaining that I talked about another option. And they said, no, they're still doing those. Yeah, I said they're still doing the letters, but they've also added another option. So there was an emergency message. I don't know if it was emergency, but it was a policy message that went out about a couple of weeks ago that said, now they're going to be able to do attestation. So if you get that letter, or if you know that you have to do your, regular proof of life, you're living overseas and you need to prove that you're still out there somewhere, then you can actually call, and people are complaining, you can't call the 800 number from Europe or wherever. Okay, you have to call someone. You call the Office of International Operations. You call your local Social Security office back in the States. You call whoever. And you can do the proof of life through an attestation, which basically means they ask you some questions, ID you over the phone, and then you say, yep, I'm still here. I'm still alive and kicking. So continue my benefits for another 6 months or year or whatever the case may be. So that's another option. But if you call, people are having a hard time contacting their federal benefits unit, and so whoever you're able to contact Social Security, it's a brand new policy that just came out. So you might have to say, hey, when you call up and they say, well, I don't know what you're talking about, I've never heard that before, just tell them, yeah, it came out in August, the end of August. Check your policy, the daily updates, and it'll be in there, and it'll tell you exactly how to do it. So how to ID and what to read for the attestation and all that stuff. So, and then they have to do it, and then they send it to Wilkes-Barre, the processing center. So
From my husband for 30 years, but to my knowledge, we are still legally married because neither one of us have filed for divorce. Would I still qualify for spousal benefits? Thank you. That's all I wanted to know. Estranged from my husband.
Stopped out. Okay. Yeah. Whether you're married or not married, not relevant right now. You were married for at least 10 years. So if you didn't get an official divorce, then your Social Security considers you still to be married. But maybe 5 years ago, he got remarried and filed a divorce, and you didn't know about it and stuff, which is irrelevant because you were married for at least 10 years. So regardless of the fact, it sounds like, you'd be eligible for benefits on his record because you're married at least 10 years. But it's also the issue of your benefit amount. So you're receiving benefits on your own record. His benefit amount has to be twice your full benefit amount. So the calculations have to be correct. And even if you're eligible, you might not get it because of, you're making over 50% of what his benefit. And remember, that switches if anything happened to him. Survivor benefits, it's not the 50% rule. If his benefit is $1 more than yours, then you're potentially eligible for that $1.
Question for you, Dr. Ed. So, after paying on an inflation-adjusted basis hundreds of thousands of dollars into Social Security, if my wife and I possibly pass away, both of us, then all that money is just gone. If one of us passes away early and the other lives to full life, then we will get a survivor benefit, but it's probably not going to add up to as much as we both would get if we lived, both of us, our full life expectancy. So my question is this: should I take out insurance for the difference between what we would expect to get for our full life expectancies versus the possibility that we both pass away early, or that or the other of us pass away early? Thanks kindly.
Whether you should buy insurance, that's completely, if you're talking about final expense, life insurance, you can reach out to our partners there, wherever the sign is there. David DeFore there, they can help you with that. But in terms of how much you paid into Social Security, and that's the social part of Social Security. It's not an individual retirement plan. It's the security of society, a safety net. And yes, but remember, as I always say, we are all one day away from having to collect Social Security benefits. So you have been very, very lucky in the sense of you haven't needed that, being on disability, or either a spouse has passed away or something like that. So you could have potentially made a lot more money from Social Security, but you have been lucky, and a lot of us have been very, very lucky that we haven't. But yes, if you pass away early, then unfortunately you lose that money, just like all the auto insurance money we paid for decades that luckily we didn't have an accident, and we never got that money back. But yeah, in terms of life insurance, that's a personal decision there. So, but yeah, surviving spouse benefits, either one passes away. Remember, you can collect surviving spouse benefits and not start your benefits on your own record. Remember, that's an option. So.
I'm helping my cousin apply for disabled adult child benefits on her mom's record. And I recently found out that her father passed away. So now I'm not sure if we should also apply for survivor benefits or if we should just see which one is more or what. So if you have any thoughts, I appreciate it. Thanks for all the hard work you put into the site and helping us out. Thanks.
You're welcome. Thank you. Yeah, 100% apply. And Social Security will always give you file for a benefit from the higher record. So if the current benefit the disabled adult child is receiving is the higher one, then that's it. But if the other one, which is probably a surviving spouse, is 75% versus the 50, then that's the surviving spouse disabled adult child benefit is usually higher. So yes, call Social Security and file for that. And if nothing else, is that terrible $255 death payment. But hey, it's your money. So whoever is eligible for those benefits, if it's a disabled adult child on that record, then they'll get that $255 and maybe some more on a monthly basis.
Hi, Mr. Ed. This is Sajid Aziz from Brooklyn, New York. My question is about survival benefits. Even if your spouse never work, she or he can file for survival benefits. And secondly, there's any age limit when you can apply, or you can apply on any age?
All right, good question. Yeah, that's our young gentleman there. That's the second question. I think he asked a question a few months ago or something. But yeah, that was a good question because a lot of people miss this. They say, "Oh, I'm eligible for benefits from my spouse or my deceased spouse or my deceased divorced spouse or my divorced spouse, whatever the case may be. But I guess I can't get it because I never paid in Social Security." Doesn't matter. Doesn't matter. If you were a stay-at-home mom, dad, whatever, and you never paid in Social Security, no problem whatsoever. If you're eligible for benefits on somebody else's record, then that's where you'll get the money from. So you don't have to be eligible for benefits on your own record. That includes Medicare. So people say, well, I never paid into it, so I'm not eligible for Medicare. No, if you were married to someone, and you're eligible on that person's record, you can get money and Medicare on that person's record. So, all right, and this will be the last one, and then we're done for the day.
Okay, I just want to make this straight. I live and reside in Taiwan, and I wanted to retire early at 62. And when I was working with the Philippines, I find out it all stopped when I told them I worked as a lifeguard. And they said you cannot work to collect early Social Security. So I was shocked and surprised. I only can work 1 month, 5 days, and I can collect early retirement. I do not go under the threshold, the yearly amount. If I go under, I can collect. That doesn't apply for me living in a foreign country. So a lot of these things are Social Security. Most of the information is related to people living in the United States. I'm a USA citizen living in Taiwan, and my place where I get contact Social Security is with the Philippines.
Okay, yes. So contact the Federal Benefits Unit in the Philippines. And so if you're working for a foreign company and you're under, like if he was in Taiwan and he was working for an American company that ran that pool and he was paying Social Security, then the regular things, 23,400 and all that kind of good stuff applies. But that's kind of cool and nice job having a lifeguard in Taiwan. Ah, that's interesting life. So yes, what you're talking about is the foreign work test. And this comes from a pamphlet, the official Social Security, your payments while you're outside the United States. And I shouldn't have jumped up there. Now I have to figure out where. So a foreign work test is, again, if you're paying into Social Security and working overseas, but if you're not paying into Social Security, then yes, we withhold your benefits. So again, under your full retirement age, once you hit your full retirement age, it doesn't matter anymore. But we will withhold your benefits for each month you work more than 45 hours outside the United States, and you are not subject to the United States Social Security taxes. So this applies even if you're exempt from Social Security taxes because of an international agreement. So basically, yes, you're correct. 45 hours. So you just need to figure out, get with your employer and say, hey, let's keep it down to 44 hours a month, or, work a month and take off a month or something like that. So as long as you're under the 45 hours, then you're good. But yes, that is a foreign work test, and you can find more of the details. There are international agreements that Social Security has with some countries that they treat stuff a little bit different because, those countries negotiate and it says, hey, we'll treat your American citizens a little bit better and give them these benefits if you give our citizens these a little bit of benefits. And they're just, some of the countries there, and they're different. They're a nightmare in terms of what little things they are. Sometimes if you pay into a foreign Social Security system, they can use those credits, and that country can use the credits we pay into it. So there's all kinds of little international agreements. They get kind of complicated. But yeah, long story short, in your particular case, you have to stay under 45 hours a month. So call up Federal Benefits Unit and say, yeah, all right, I talked to my boss and I'm going to stay under 45 every month. And they'll say, okay, all right, there you go. You're good. So you get your benefit amount. So, all right, that is it for today. I'll be back again tomorrow. If I didn't get your question, I apologize, but I'll be back again tomorrow. And tomorrow we're going to have Chapter, one of the representatives from Chapter on the success team, member success team. And those are the people that help you after you enroll in a plan, that after service that helps you find a doctor when you need, if you get prior authorization, help you navigate that nightmare. If you get some weird letters from your Medicare or whoever Medicare plan, they will help you, translate that into English. So hopefully if everything goes well, she will be here tomorrow. And I will be here and answer all your questions. Y'all take care. Have a beautiful night. And please, 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 please take care of each other. Bye-bye.